So here's the flap of tissue that we've dissected. All right, so we've done all the elevation that we need to. So the tissue is removed. Well, estimate is probably about, I don't know, 2 pounds. Hi, I'm Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we are going to be performing a circumferential abdominoplasty as well as liposuction of the flanks and the back and fat transfer to the buttocks. So this patient has lost about 50 to 60 pounds. And so she has a fair amount of laxity, as you can see, that kind of goes here on the abdomen, but kind of goes all the way around. So she's also had some volume deflation in the buttocks in this area here. So that's the procedures that we're going to do. So I will show you some of the key steps as we go along. So the patient's here in this lateral position, and I've already done liposuction in these areas right here. So we have the fat ready to do the fat transfer to the buttocks. So I'm going to start with the fat transfer to the buttocks. So here we have, with the same handpiece that we use, we're going to go directly from the fat transfer reservoir back through this liposuction cannula and start doing fat into the buttocks. These are the area it kind of needs it the most. So we'll get started here. Here we are, the fat is being injected again directly back into the buttocks from the fat transfer reservoir. And I'm going exclusively into the subcutaneous plane. So we are not in the muscle, but we are in the area where fat normally lives. So I'm going to keep doing this here until we have a decent amount. And we need to make sure we have enough fat for the other side as well. So I'll show you once we're all done. All right, fat transfer is done, about 400 cc's into the buttocks. Now we're going to do the lift. So that's going to move the whole buttocks up, and it's going to tighten the skin as well. So that will give us a really nice look. I've injected with local anesthesia, like you've seen me do in the past, and that just really helps cut down on the bleeding on this initial incision. So we'll take this about to this area here, and then the rest of it, after we do this part, the rest of it's going to be done from the front side, or when she's face up, and that will be incorporated with the standard abdominoplasty. So here's the flap of tissue that we've dissected, okay? So I've measured that, and indeed, just about where my marks are, we can go ahead and excise and I think be able to close without any significant undue tension. So I'm going to go ahead and make that incision now. So now we'll just go ahead and use the cautery. We can go ahead and take off that flap of tissue. That was there. And I'll show you once we get that all off. So we're just finishing closing this side here, so you can see now with the lift and the volume what that's done. You can kind of, I know she's lying, but you can compare it to this other side, and I think you can get a good appreciation for what the difference is going to be. So then of course with the liposuction we got the contour, so I'm really happy how that right side is gone. We're going to put her in the left side up position, and we will do the other side. So now we have the in the left position, so we can work on the left side. So I'll start with the liposuction. We haven't done anything here, but you can see, you can appreciate the difference here, you know. So this hasn't been removed, so you know of what we're going to sort of get with that. Anyway, we'll get started here with the liposuction. Suction is all done. Now I'm going to start with the fat transfer. So just like I did on the other side, I'm going to clamp, and so now the fat's it's going directly from the fat transfer cannula back into the buttocks. And so I will continue on with this. We'll do basically the same amount of fat like we did on the other side, and then we will start with the excisional portion of the procedure. So we're done with the fat transfer. Now we're ready to start with the excisional procedure, just like we had done on the other side. So here we go. All right. So I will elevate this flap just like we had done on the other side. And we'll check it before we actually make the excision. Hopefully it will be just about the same in the way of the excision, and then we'll excise that and we'll start to close, but I'll show you some of the steps as we proceed. The tissue has been excised, and then we're going to close, and then the way I like to close it is I like to use these towel clamps because it helps me keep things aligned while we're closing, so I don't have to worry if they're aligned. I can just concentrate on the actual closure itself. But you can see here, see what the lift, that just did right there. So we're going to start on the abdominoplasty portion. So we also did perform a brachioplasty, but I didn't really show that because I wanted to concentrate just on the trunk portion. So you can see here, these are the dog ears, or the redundant skin that's left over from the closure that we did on the back. And so now we just need to really, it's basically doing an abdominoplasty and just joining it with this previous incision that we created posteriorly. So I'll go ahead and start with the incision. So I'll start working on this, lifting that, and I'll show you once I get a little further. All right, so we've done all the elevation that we need to. We've cut around the umbilical stalk and left it attached to the abdominal wall. These were we put drains in posteriorly, and here they are coming out anteriorly, and we'll have them exit here near the pubic hair area. So now I'm working on the myofascial plication. As you can see, I have a suture already in there. And so that's just going to bring the fascia together. That's just the covering over the muscle, excuse me. And that's really what provides the strength with the abdomen, is that fascia layer together with the muscle. So people often say you're tightening the muscle. You're not really tightening the muscle per se, but you're bringing the fascia together that includes the muscle, so you're bringing it more over to the midline. This is where oftentimes you'll have weakness, and that's usually from pregnancies. So we'll continue on with the myofascial plication. We'll flexor, we'll excise, we'll start to close. We have gone ahead and flexed the patient, and so I brought the drains through. The myofascial plication has been completed. We put little sutures around the umbilicus just to keep it oriented when we pull it through the skin, so we know it doesn't get twisted. So now we're ready to go ahead and start removing this segment. So you can see it's going to join up with that posterior incision, so it's going to look like one continuous incision, even though this was done in two parts. Okay, so I'll go ahead and remove the rest of that flap, and then we'll irrigate and we'll start closing. So the tissue is removed. I estimate it's probably about, I don't know, 2 pounds or so. So anyway, there's the tissue. And then we've already started closing. I put these towel clamps on, just like I do on the back. It just helps me align things. And so now I'm going to put the sutures in for the final closure. This was a third drain we put in that comes up this way here, and then the other two go to the back. So we're getting close to the end. The last thing we need to do is need to make another hole in the skin, bring the umbilicus back up and inset it. So we're all done. You can see the incision's completely closed, and then it meets up with the posterior incision. The umbilicus has been inset, drains are in, so she's ready for dressings and go to the recovery room. Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso. Again, if you like these videos, please give the thumbs up and also become a subscriber so you can see all the latest videos. Thank you.